Coming to you from the UltraStaff Studios in Chicago, welcome to the Staffing Buzz Network with your host, Bob Petke. Hello, everyone who's listening in and watching. I am Bob Petke. I am your host, and welcome to the Staffing Buzz Network. We are here in that busy season right now. We are in the fall, where we've got a bunch of some of the very big shows, the very big granddaddy of them all events in the staffing industry. And today we're going to have a guest on with us. I'll talk a little bit more about her in a second, but we're going to be talking about the healthcare conference being conducted and held by the Staffing Industry Analyst, the SIA. So we'll talk about that in a second. But a reminder who I am again, Bob Petke, your host here at the podcast for Staffing Buzz Network. I'm also the Chief Sales Officer for ABD, Automated Business Designs. And just in case you forgot, we are a full-service ATS, CRM, front office, back office solution that is making lives easier for folks in the staffing world. We've got a bunch of AI integration to go ahead and make sure that you've got that space covered, making your life as easy as we can so you can put people to work faster, so you can have less turnover, and so you can keep track of things along the way. So we're always glad to be here and talk a little about who we are as an organization. But really today is our chance to showcase an annual event that is, again, held by the SIA, and it is the Healthcare Staffing Summit. It's being held November 5th through November 7th. It's at the Red Rock Resort. So we are excited. We're going to bring on probably one of the best names in show business, if not staffing, Crystal Fullilove. So Crystal should be popping here on the screen here in just a minute. And just to give you a little history of who Crystal is, Crystal Fullilove has been, in the healthcare with a healthcare staffing analyst group, SIA, for the last 3 years. Her research has included all aspects of healthcare staffing, workforce solutions. And prior to joining SIA, Crystal spent 4 years, that's right, 4 years in staffing, in the healthcare staffing on both the buyer and staffing side, managing clinical traveler programs, as well as managed service providers, MSPs. Oh, by the way, we have MSP program here at ABD, Ultra Staff Edge. But again, not about us. Crystal, welcome to the Staffing Buzz Network. How are you?
I am well. Thank you so much for having me, Bob. I'm thrilled to be here.
We're so glad to have you, and we're excited. We're going to be in attendance, and we've been there the last few years, and it's a really great event. Can you tell us a little bit more about yourself and your background before we get started into really what's going on here at the event?
Yeah, absolutely. So I began my career in healthcare staffing on the buyer side, as you mentioned, working for a large health system where I managed their contingent traveler program across 12 entities. And in that role, I oversaw vendor relationships with our MSP partner. And I worked closely with nurse managers and physicians who are really the ones who are advocating for these additional workers to help meet patient demand and really ensure that staffing balance. And being at the intersection of workforce needs and vendor operations gave me firsthand insight into the critical role that contingent staffing actually plays in maintaining quality patient care. And so during that time, I was able to also develop a strong understanding of the technology that powers the vendor management lifestyle. So onboarding, compliance, to payments, to analytics. And it's an experience that really deepened my appreciation for how data and technology really drives efficiency and transparency across healthcare staffing operations. And after spending a few years on the hospital side, I transitioned to the staffing agency side. And I also managed MSP programs from that side. So it was a new perspective, seeing the operational logistics and strategic challenges from the supplier's point of view. And that just kind of reinforced the importance of building strong partnerships and streamlined processes with health systems and how we can remain focused on delivering exceptional patient care to them so that way they can focus on their staffing needs efficiently, effectively. And that brings me to today as a healthcare staffing analyst at SIA. And I have the privilege of leveraging my field experience to conduct the research that helps healthcare staffing firms and MSPs and suppliers really better understand the evolving dynamics across the industry And so, my work is data-driven decision-making, and it helps organizations anticipate trends and prepare for future stages of growth and navigate emerging challenges in the healthcare staffing landscape, all things that the Healthcare Staffing Summit is going to speak to as well.
So you are at the very least a dual threat, having both that buying and staffing side of it, plus all that experience of being able to do the analytics that you need to be able to do your job successfully. And that's a key component to staffing, right? Is, first of all, the job is always pretty, I don't want to say basic, but there's just some things you do. First thing you do is you find a client. Then you find a person to go to work, and you put the two together, you get them paid, and then you get yourself paid along the way.
Yeah.
But there's so many different analytics and different things that are involved in that, which kind of leads me to, some of the things that are going to be the theme of the conference here. So the theme is going to be navigating change, technology, and opportunity. And then there's some concurrent tracks that I have listed here: operational efficiency and growth opportunities track, transformation, compliance, and innovation track, travel and allied trends and best practices, physical staff or physician staffing, locum tenens, and per diem nurse track. So there's a whole lot of curriculum there in analytics that's involved in understanding those data points.
Mhm.
So with that said, and for those who have never been to the SIA Healthcare Staffing Summit, and hopefully we're reaching some of those people here because we're, a little less than a month away. Maybe some people are kind of on the fence or hearing about it for the first time. Can you tell us a little bit more or help the folks that are listening in that are considering attending? What should they expect, from the conference?
Yeah, so it's our annual conference dedicated exclusively to the business of healthcare staffing. So we focus on all segments of healthcare staffing, including platforms, digitization, legislation impacting the industry, and a whole lot more. And it's really just an opportunity for staffing executives to make new connections, to network, to explore market dynamics, and also access SIA's latest research and experience firsthand the valuable resources and tools that we're able to provide to help support informed business decisions for healthcare staffing firms and suppliers alike. And it's a conference that continues to evolve with the industry, which is why I love the theme for this year, the Navigating Change, Technology, and Opportunity that you talked about, because it really just reflects that momentum. And in terms of the sessions, we built them from in-depth conversations with healthcare staffing leaders and industry associations,
Right.
as well as insights that we pulled from our own benchmarking data, just to ensure that the program is actually delivering real ROI and aligns with what leaders want most. So the agenda for this year actually features our strongest lineup, which I'm incredibly excited about, and it features a record number of locum tenens sessions. We have new content on advanced practice and physician search, which historically we have not. And we have forward-looking discussions on AI's growing impact across healthcare staffing. So it's definitely a don't miss event.
No, definitely on point, right? And these are all the hot topics in the industry, as we are an ever-changing, ever-evolving industry at that. My question for you now is, okay, so we're thinking about going, or, we're going to go there and we're going to rub shoulders with people. What's the typical audience? Who usually attends the Healthcare Staffing Summit?
Yeah, so attendees are typically designed for, the summit's typically designed for staffing leaders across the healthcare staffing industry, and we draw in executives from the C-suite, but we also have directors and other senior leaders attend. And I guess it's important to call out that we do welcome an expanding audience, because we recognize the importance of equipping professionals across all levels of the organization, not just the C-suite, with data, with insights, with resources to drive, meaningful impact. And by ensuring that as many employees as possible have access to that information, we empower them to take those valuable learnings back to their teams, which they can then translate into smarter strategies and informed business decisions. And I think we'll touch on this as well, but in addition to the more than 80 sponsors that we have, the over 400 companies that are already registered, many of them bringing large teams with them that include first-time attendees and longtime participants, there's going to be access to a wealth of expertise and meaningful networking opportunities.
Crystal, one of the things I know Crystal Fullilove. There it is. No good conference goes without a good keynote. Can you talk to us about, am I safe to assume we've got ourselves a keynote? And if so, what can you tell me about maybe perhaps the opening keynote?
Yes, we do. And I agree. It's a fan favorite for sure. So our first full conference day is on November 6th at 9 a.m., where Barry Asen, SIA's chief analyst, and I will open the keynote, which is called The Next Chapter in Healthcare Staffing. And it draws on our research, and we're going to explore key market dynamics, critical trends. So think of things like MSP and VMS evolution, new staffing models, policy and compliance pressures, leadership and culture, and strategies for improving profitability. And we'll talk about it through the lens of real-time analytics and automation. And it's essentially a session that sets the stage for the conference, and it just helps you identify which areas you want to explore in greater depth as the conference goes on. So it should be good.
That sounds like a lot of fun.
Yeah.
It looks like you got some work cut out for you to get yourself ready for that. So very exciting for you. Congratulations on that.
Thank you. Thank you. Should be good.
A lot of sessions coming up, right? Can you highlight maybe a couple of sessions that are going to be happening? And maybe even more importantly, as you go over that, why these are considered the critical topics in the healthcare staffing industry?
Yeah, I think that's a good question and a difficult question. We have 23 sessions, including keynotes and concurrent sessions, that were designed around those 4 tracks that you touched on earlier. Each track and session was carefully designed for relevance in today's healthcare staffing market. So there's not really a single topic that outweighs another, but in terms of just highlighting a few, we have one on integrating AI and tech, which explores real-world applications of AI in sourcing, credentialing, historically a pain point, right? Screening, sales, and it just showcases how technology is transforming efficiency, compliance, and quality across the talent lifecycle, all really important in a very margin-tight environment. We have a session on travel nursing at a crossroads and winning in locum tenens. And those 2 sessions offer more of a forward-looking strategy for 2 of the industry's most competitive segments for different reasons. We also have mergers and acquisitions in an evolving healthcare landscape session. And that examines consolidation, investment trends, policy changes, and how those are really redefining competition across the healthcare staffing ecosystem. But beyond the SIA sessions, we also have 6 ideas and action sessions, and those are sponsor presentations. They are designed to provide exclusive insights into product innovations, client success stories, practical ways solutions can actually help staffing firms kind of accelerate their growth. So I think all of the key trends in healthcare staffing are on the agenda or will be showcased at the conference. And so I do think it offers valuable insights and strategies for firms of varying sizes. It's not just catered to those who are the largest.
Okay. So there's going to be a lot of people here at the summit, the Healthcare Staffing Summit, November 5 through 7 in Vegas, and we'll give you Crystal's contact information as we go to a conclusion here. But we're still just a minute away from that. But again, a lot of people, a lot of sessions. What is your advice to attendees? Right? They want to make the most of this conference. They're taking time off. There's being investments made for them to go there. There's so many sessions and there's a lot of interest happening at the same time. What would be some things that they can do to prepare? What would be maybe even some advice that you would have for them?
Good question. One we also get every year, and we like to share this at our pre-conference session to help folks understand what to expect from the summit. And essentially, it comes down to our recommendation of divide and conquer. So having at least 2 team members attend allows each person to join concurrent sessions that are relevant to their business. And attending in person provides access to over 100 expert speakers and networking opportunities after the sessions. In addition to that, all attendees have access to the session recordings on the app for 90 days post-event. So they can actually go back and rewatch the sessions when they return home that they missed. You can also download presentation slides that are uploaded for each session within the app. And it just ensures that no one misses key insights or data.
Thank you. One of the things I was looking at the agenda and I saw a little bit about these the networking roundtable discussions, and it sounded pretty cool to me. Can you talk a little bit about that?
Yeah, that's the summit launch. That's our launch pad. And it's held on the opening evening of November 5th. So the moment attendees arrive, we immerse them in high energy sessions designed to spark meaningful conversations and collaboration. And there are 26 facilitated networking discussion table topics, and they range from specific dynamics in every segment of healthcare staffing to AI and recruiting to leadership to engaging teams. And there's going to be 2 rounds. So they're 30-minute peer-to-peer discussions, and they bring together leaders and innovators across the industry. And it's a conversation where they can talk about the biggest challenges, discover new solutions, and even contribute to conversations that are shaping the next stage of healthcare staffing. And every year, attendees rank this as one of their favorite sessions, right up there with the keynote. So they always tie it back to powerful networking and new partnerships, actionable takeaways that executives can actually bring back to their team. So definitely book an early flight on November 5th so you don't miss the roundtables that start at 5 p.m.
Great. No, thanks for that. And so it's going to be held again, the Healthcare Staffing Summit, November 5th through the 7th at the Red Rock Resort in Las Vegas. I know there's an exhibit hall and there's these different sessions. Can you provide a little bit more detail about the venue itself and what to expect?
Yeah, good question. So in addition to roundtables, 23 SIA sessions, and 6 sponsor-led sessions, we also have 84 sponsors to the event. So it's an incredible number. And those sponsors range from front and back office providers, AI agents that can help minimize or really optimize businesses, solutions to enhance candidate engagement, sourcing automation, fintech, payroll providers, and so many more. And the exhibit hall really offers a chance to connect with leading providers and an opportunity to explore the latest technologies, which is always a big hit, and discover solutions that can boost profitability and efficiency. And it's a challenging healthcare market today, right? And so the exhibit hall just provides an ideal opportunity to build partnerships that can enhance performance and that can position staffing firms for success.
Great. One of the things, and I've been to several of these as an attendee, as an exhibitor, and one of the things as an attendee I've asked myself is, am I finding myself in a better place than I was before? In other words, are the folks at SIA going to leave me better or have me better equipped and inspired and motivated and have knowledge more than I was before I got there? So with that in mind, and I'm sure that's part of the focal point here, right? That's why you've got returnees every year. How does the Healthcare Staffing Summit ensure that every attendee leaves inspired, informed, and better equipped? How do you do that? How do you ensure that happens?
I like your pause and your hesitation and emphasis on ROI. I got goosebumps a little bit because it's a really important question.
Wait a minute, Jennifer, did you hear that? Goosebumps. All right. I'm going to save that part of the clip. All right, Crystal Fullilove, you keep going.
All right. So I think the short answer is tying it back to our purpose at SIA, which is to inform, connect, and elevate the workforce solutions ecosystem. And you can see that come to life at the Healthcare Staffing Summit. And the healthcare staffing landscape this year is really shaped by challenges and opportunities. There's demand in areas like outpatient care, home health, locum tenens, but at the same time, margin compression is real, differentiating is confusing, competition is fierce, and the industry faces major workforce gaps over the next decade. So the summit equips attendees to navigate those shifts with exclusive data, with expert insights, with practical strategies, while also fostering meaningful connections with peers and leaders across the healthcare staffing industry. So at the end of the day, I think it's a place to gain clarity, to gain confidence and community, so that way we feel like we're facing, these healthcare staffing challenges together.
What more could you ask for as an attendee? Again, knowing ahead of time that you're going to be better equipped than you are when you first started. That's phenomenal. So, Crystal, as we conclude here, And, people are listening. This is going to be shared. It's going to be on all of the major podcast platforms. It's going to be on YouTube so people can actually watch us. We can go back and watch ourselves. How are people, how can they get in touch with you? So that if they've got more questions or maybe they want to talk about some of the things you've mentioned here today, what's the best way for someone to get a hold of you?
Well, if you're interested in registering for the Healthcare Staffing Summit, you can go to healthcarestaffingsummit.com. But I am also the only Crystal Fullilove on LinkedIn, so I'm very easy to find and happy to connect on social and answer any questions related to the conference or even SIA membership. And of course, you can find me on the SIA website, staffingindustry.com as well.
Crystal, I would place a bet, and every time I do, sometimes I win. You might be the only Crystal Fullilove in the galaxy. And if somebody wants to show me otherwise, I'd be glad to hear it. So if somebody's listening and wants to put in the legwork, let us know here. But Crystal, we're so glad to have you on, and we're excited to be a participant, to be at the Healthcare Staffing Summit, November 5th, 6th, and 7th at the Red Rock Resort. Get a hold of Crystal, go to the website, and if you haven't already, if you've been thinking about it, utilize this information, go back and look at the key points or listen to the key points. And we expect you there. And hopefully we're going to have a really extraordinary large crowd. So Crystal, thanks for joining us. Before we go, any other parting words or anything?
No, thank you so much for allowing me to speak to the Healthcare Staffing Summit and for having me on the podcast. I greatly appreciate it. And I look forward to a successful event.
Crystal, you are a gem. I've decided gem is going to work for you. So with that, Crystal, thanks so much for being here on the Staffing Buzz Network. And so there you have it. Crystal Fullilove was here, and lots of tremendous information to share. And if you're thinking about it, and this is the space and place where you operate, or if you're even contemplating getting involved in healthcare staffing, it's one of those sweet spots that when people do it, they do it well, they do it right. You get a big return on your investment. Make sure you figure out, get yourself to Vegas, Las Vegas, at the Healthcare Staffing Summit for November 5, 6, 7, and get yourself registered there. So with that said, as a reminder, I am Bob Petke. I am your host of the Staffing Buzz Network, also the Chief Sales Officer here at Automated Business Designs. And let me see if I can point here. And our software is called Ultra Staff Edge. And thanks for joining our podcast. And reach out to me. My email is bob@abd.net, bob@abd.net. No reason why, if you're interested, you can't just email me there. And we can talk a little bit more about how our software integrates. And we do some tremendous stuff when it comes to pay package calculators and per diem nurses, per diem and travel and credentialing. Our solution is right there and gets it done, and it's a leading ATS CRM tool. So reach out to me about that. But again, until next time, I am Bob Petke, and thanks for joining us here on the Staffing Buzz Network.